Talking about the actual thing that I titled. Hold on, let me set up the. Let's get a non-shadowy vantage here. Okay. Of course, I can't begin by talking about chiropractic and the immune system because that's what the title is. You can never talk about the thing that you titled it immediately. So, thanks for watching today. I appreciate you very much. Now, let's just start off really quick with chiropractic and the immune system. We'll get to that very specific, detail-oriented topic that I want to just generally glaze over. But first, really two quick stories that are great stories. My last patient of the day today, younger man, he's 26 years old. He is a motocross racer. Motocross is tough. I actually had 3 motocross racers today, a couple, a man and a woman, and a younger guy. And it's a rough sport. What can I say? I mean, you're on a motorcycle, you're jumping, you're pounding, you're hitting the ground, you're holding the machine, the bike. It's vibrating. It requires a lot of muscular effort, and it seems like it's an unathletic thing to do. But even stock car driving is very requires a lot of athleticism. And so I guess it's not like baseball, basketball, football where you go out and you stretch and you do your things. Like, you pretty much just get on the bike and ride, from what I can gather from my minimal experience in taking care of people. And so it's absolutely it's so important for some of these riders to kind of eventually realize that it's tough to ride, and to be warmed up before you ride is a really good idea. But my last patient of the day is a younger man, and he's been riding for a long time. And even though riding typically is his highest red flag, like in all of his history, the riding is the thing that he does the most that hurts his back. He was hunting over the weekend. He was sitting in a chair and he's not doing too much. He's not stretching. He's not moving. And then all of a sudden he comes back from hunting, and the next day he's in the shower and he just reaches up to wash his hair, and boom, something goes out in his mid back. And then he's on the ground. He can't even move, okay? So this is a week later. He's in my office tonight. And a week later, he is still unable to really laterally flex to the right. He can laterally flex to the left, but this is just immediate, pain, right? He can't do it. It's dysfunction. And so I adjust him, and immediately he feels better. And he's like, oh, it's a miracle. And it's like, it's not a miracle. This is the easy thing in chiropractic. And musculoskeletal pain is the easy thing. And so, but it's easy for chiropractors. We see so many results that it's been within the profession's history that we use these results to make these blanket statements. And so, and then sometimes those blanket statements get explored heavily scientifically. And one of those blanket statements is that chiropractic is good for the immune system. And so being good for the immune system is particularly important because your immune system is what guides your health. There's a very famous quote by Clarence Gonstead, one of the proponents of chiropractors, a great chiropractor who made a lot of progress in the field. And he said that medicine is the study of disease and that which makes men sick. Chiropractic is the study of health and vitality and that which makes men live. And so chiropractors, as we step more into the scientific realm, have been exploring things like chiropractic and its effect on the immune system. Now, it's really important to understand that chiropractic is obviously effective for musculoskeletal health. I mean, it's unarguable at this point. And so tonight, I wanted to talk about chiropractic and the immune system. I have this really cool study somewhere. I can't find it. But it's the study on how chiropractic affected a DNA a marker in the blood that measures whether or not DNA is repairing. Okay, this is one very awesome study. I will find it. I'll bring it back on another night. And so I went exploring into the phone, and I just real quick, let's see what the internet says. And so I tapped the internet, and I was like, ChatGPT, tell me about chiropractic and the immune system. And so the first thing that comes up and says that chiropractic makes these claims that it's good for the immune system. However, it's not been substantiated by science. So I click on the link and I go to it, and it's not the usual list of chiropractic haters. There's definitely a small group of researchers who love to write anti-chiropractic papers. And these papers aren't really refuted by people in the chiropractic profession because we know that they're garbage. And we just don't give it the attention that it needs because we have plenty of high quality studies, which I found one right here, which I want to talk to you about. So anyway, but I go to the hater study first, and I'm like, okay, it says that chiropractic is not good for the immune system. So I go deeper into this study and I read it. And the interesting thing is, as with most studies, there's these they think it's systematic, but it seems very arbitrary to an untrained scientific eye of why they include studies or not include studies into their conclusion. And so the interesting thing about this one hater study is that they say very specifically in the conclusion in the paragraph that chiropractic hasn't substantiated that it's good for the immune system, but it also can't be refuted either. And so they say it's important for chiropractors to be careful when making the claim that chiropractic is good for your immune system. How can your back getting cracked be good for the immune system? I thought it was just good for neck pain and headaches and all those things. And so I dove into this research, right? So here's a discussion that they talk about why they found that chiropractic was not good for the immune system. Okay, this is the study. And this is the discussion section. So I'm going to read through here. This is going to take 2 minutes. Okay. In this systematic review, no evidence from acceptable or high quality RCTs, randomized controlled trials, was found to support or refute the efficacy or effectiveness of SMT, spinal manipulation therapy, to prevent the development of infectious diseases or to improve disease-specific outcomes among patients with infectious diseases through its consequences for the immune system. Now, we have to immediately unpack that, because when a chiropractor says, okay, getting adjusted is good for the immune system, there's a reason why we make that claim, okay, which we'll get to. But when these PhDs go in and they're going to say, well, let's see how that claim holds up to science. First of all, they look up all the literature, and then they begin discluding and including certain studies based on their criteria, which are very specific to them. Okay, so you can see that in this statement right here, okay, they found that there were no high quality RCTs found to support or refute the efficacy, if it's efficient, that manipulation prevents the development of infectious diseases or improves disease-specific outcomes. Okay, they just took this, chiropractic is good for the immune system is like this very general, broad statement. But then to narrow it down to this, well, we didn't find any studies that said that it was good for infectious diseases or for specific outcomes among disease-specific patients. These are two completely different things. And so why do chiropractors say that it is good for the immune system? Well, this study goes on to say, although, in the next statement, they're like, chiropractor hasn't been refuted or proven, although they found 8 high or acceptable quality articles were identified that suggested SMT may be associated with immediate changes in immunological and endocrine biomarkers. These findings were preliminary and mostly based on the in vitro observations that appeared to be dependent on study methodology. What that basically means is that in these studies where chiropractors tried to associate the adjustment with the immune system, is they went in and they looked at these specific biomarkers. They looked at white blood cells. What's your white blood cells before you get adjusted? What's your white blood cells after you get adjustment? It seems like a pretty specific statement. So that's why they discluded them. They discluded these statements because it didn't meet their criteria of the title that they chose. That's not science, okay? That's bias is what it is. And so furthermore, the studies were conducted among asymptomatic participants or patients with low back pain, and their clinical relevance is unknown. So basically, chiropractors took groups of people with back pain or with no symptoms, and they measured their white blood cell count and immunological functions in the blood, adjusted them, and then remeasured their blood and said, let's see what happened. And so they found some really interesting things. And these guys who want to hate it, they go, well, it's important to note that of all of these studies included in the systematic review, they were in phase 0, which is exploratory studies, including those with a high risk of bias that were not included in the synthesis, and therefore could not be used to assess the efficacy and effectiveness of SMT in preventing the development of infectious diseases or improving disease-specific outcomes in patients with infectious disease. So it's two completely different things. And hold on, let me just summarize that with the end, I guess there would be, okay, so when they say it's not clinically relevant, okay, well, it's because there was no specific clinical indications in the chiropractic study. They really were just looking at blood markers and the immune system. So this study, throughout the 8 best studies that chiropractic had, this study, which was trying to review, said those don't count. That didn't meet our criteria. We can't use those. So I went back through the citations and wanted to find more about those 8 studies. And so I found this other review that came from, it was a Canadian Chiropractic Association. Huge article. There's just like, I mean, there's 100 pages here. I'm not even sure. And this was a review that chiropractors did within an internal study. And so I loved this study. Okay, so a literature review sought to determine the effects of spinal manipulation on biochemical markers. That's it. That's what this study did. 8 studies to identify the effects of spinal manipulation on biomechanical markers in humans and establish the level of evidence for changes in biochemical markers. Spinal manipulation, defined as high velocity, low amplitude thrust technique, the cracking that you see all the time. Among the outcome measures sought were neuropeptides, specifically neurotensin and oxytocin. 2, inflammatory TNF and IL, that's interleukins, white blood cells. And 3, endocrine, cortisol, epinephrine, and norepinephrine luteinizing hormone. And biomarkers from any body fluids, blood, urine, and saliva. After removal of duplications, they still had 1,217 citations, which were screened and that were culled down to 96 abstract. 45 full test articles were assessed for eligibility, and a total of 8 trials were included in the review. So chiropractors did 96. There were 96 abstracts that cited back to these original 8 studies, which were included in the other study, but they mentioned them but discluded them from their data. So this goes on. This is really a great conclusion here. The review found the studies varied in study design, quality, and outcomes. And the conclusion after the review was that a moderate level of evidence existed in the 8 studies, which found that spinal manipulation influences various biomarkers, typically identified as ones not only involved in pain perception, modulation, but also an important role in inflammation, tissue healing, and immune response. Studies in the review found that spinal manipulation influences various biochemical markers. Spinal manipulation can increase substance P, neurotensin, oxytocin, and interleukin levels, and may influence cortisol levels post-intervention, right? And so even though the other study actually goes in and says that they found these 8 studies, right? And they contacted the authors of all 8 studies, and just to kind of see, they wanted to ask them questions about their scientific methodology. And only one person responded to that reach out. Only one person responded. And so they couldn't include those other 7 studies because no one answered the phone. Unbelievable to me. So this goes into low back pain and some of the inflammatory markers that are increased. And there was one more here that, here's the interleukin one, and here's the cytokines. And so I think that the most important thing that I found here, let's just go here. There's this one that was really interesting too. There was a literature review of tumor necrosis factor, TNF, well-known inflammatory cytokine in the pathological development of various human diseases. Its physiological roles in the molecular mechanisms underlying spinal manipulation therapy, and we propose a novel mechanism by which SMT may achieve clinical benefits by using certain beneficial features of TNF. That's crazy. And so I think that to overarch this whole thing, what it really means is this. Chiropractic's effect on the immune system is usually indirect. Okay, there is a direct effect on the central nervous system. We showed that week 1, the first video that I did. I showed you guys the brain scans, right? Before the adjustment, the brain was all lit up. There's all interference there. After the adjustment, the brain was very calm. And so the effect on the brain, the central nervous system, is the key element and the key focus of chiropractic. Always has been, always will be, to a serious chiropractor. And so we already know that stress increases biomarkers, cortisol levels, to be very simplistic. I mean, but there's way more. But just increasing the stress biomarkers because of your job, because you're this, because you're that, whatever it is, that is well documented. We know that stress increases the body's chemical factors that delay healing and that increase pain. We know that those things are true. And we know that chiropractic has an effect on the immune system, specifically the sympathetic and the parasympathetic nervous system. So for the same reason that people watch chiropractic videos on the internet, is because it helps them relax, there is a even stronger effect when people are getting adjusted. And that effect is on the central nervous system, which then has an indirect effect on the immune system. And chiropractors are there. We're doing the dirty work. We're measuring white blood cells. There was a really famous study that was done at my school, Life University, where they took HIV positive patients. They had two groups. They had HIV positive patients who got chiropractic care and HIV positive patients who did not chiropractic care. And guess which ones had higher white blood cell counts? I mean, like, duh. And so the chiropractic model has been looked at in specific infectious diseases, which totally get ignored by these systematic reviews. And that was a good study. It was a high quality study, and I don't know why they didn't include it in their review, and why ChatGPT obviously has a bias against chiropractic. Or it just requires specificity, because there are a lot of things that people can do to increase the immune system. And I think that's one of the things that chiropractic has actually, it's difficult to study a chiropractic practice unless it's a randomized clinical study, because when you go to a chiropractor, not only do you get adjusted, which increases the biomarkers, but you also get someone who listens to you and cares about you, and then someone who makes suggestions on your diet and supplementation, and someone who may suggest meditation or taking a day off or whatever it is that a person needs. And so you can't really study that specifically. That's not scientific, because those people it's not scientifically proving chiropractic's effect on the immune system, because those people are getting care over multiple different genres. You know, it's not just getting your back cracked, even though we know that getting your cracked back has a direct effect on the immune system. So that's it. That's the spiel. There's deeper things. This goes way, and I can leave a link to this on chiropractic.org. But if you just start Googling ChatGPT and chiropractic effects on the immune system, you can see that the critical components scientifically, when they say that chiropractors can't make that claim, they design these systematic reviews so specifically to exclude all the good evidence. Even though that study that says that the title says chiropractic has no effect on the immune system. But if you read this study, it'll say that chiropractic has shown moderate evidence, moderate is good, moderate evidence that suggests that there are immediate biochemical changes in the blood after people get adjusted. But we don't want to use any of those studies. C'est la vie. That's just the way that it is, because of where the money is. Just watch where the money is. So, hey, thanks so much for listening today. If anyone has any questions about this, go ahead and shoot them right now. I really appreciate you guys checking out the channel. Thanks for watching Chiropractic Care and Education, because this channel is really the work. It's made possible by my other chiropractic channels. And not only do I have the opportunity to help people online by making videos or answering questions in live feeds like this, but also giving people chiropractic care who can't afford it. I just approved someone today for chiropractic care, and he's going to get massive amounts of treatment for pennies, and I'm happy to do that, because you only live once. What are you going to do? It's not all you can't. What are you going to do with what are you going to do with $1 billion? You know what I mean? If you're not turning around and helping the people around you immediately, the people around you, then what are you doing? Why are you here? Anyway, that's how it works in my brain. So, hi to everyone who's here. Thanks for coming along. I really appreciate it. Feel free to give a like on this video. Go check out some of my other videos. I'm just getting started here on chiropractic care and education. I'm going to keep talking about the immune system and the nervous system and chiropractic adjustments, because it's obvious that chiropractic is good for back pain and neck pain. You guys have seen there's thousands of videos where you could see it happen in real time. You could see people limping and unable to perform daily actions, then they get adjusted and they feel better. But the musculoskeletal system and pain, that's the easy thing of chiropractic. That's the bread and butter, baby. But when it comes to whole system health, even a good chiropractor will not just say, well, all you have to do is get adjusted. I mean, there's crazy chiropractors out there who think like, oh, all you have to do is get adjusted and then your immune system is fine. Of course, it's not that simple. But a good chiropractor is checking in on your diet, checking in on your supplements, checking in on your sleep, checking in on your water, checking in on your mental health and your relationship statuses. All those things are extremely relevant in your immune system. So, I kind of get real quick. We'll end it with this. I do get I don't know how would I say, I get harassed, I guess is a word I could use, by my best friend chiropractor and my mentor chiropractor. They harass me or make fun of me because the name of my practice is Pain Relief Chiropractic. And they're like, it's so much more about pain. And there's this theoretical way to practice in chiropractic where you don't mention pain. There are chiropractors out there who you could say my back hurts and they'll be like, I don't care because I'm just going to adjust your spine and as long as it's aligned, everything will work better. Those are extreme, okay? Those are extreme chiropractors. And, they do good work, they do, but for me, I never clicked. Like if someone comes in and they have pain, I'm going to be like, tell me about your pain. I can help you with your pain just by listening and identifying parts of your lifestyle that are increasing the pain where you can change it when you're not. I'll adjust you and you'll feel better. That's good. But what about tomorrow? We need to make sure that you're good to go. I need to give you the tools that you need. And so, let's see. And so anyway, the whole thing is they're like pain relief chiropractic. It's an insult to chiropractic to base it just on pain when the chiropractic is so much more than just pain. And so, but the thing is though, there's two ways to name your chiropractic practice. Like my mentor, it's his name, blank chiropractic, okay? But I can't do that because my last name is Binder and it sounds like binder if you read it. And maybe people don't know that that's my name. Maybe they think that that's the kind of chiropractic that I practice. And binder chiropractic doesn't sound like a very comfortable kind of chiropractic. So I couldn't name myself by Binder Chiropractic. And then the other way to name your chiropractic office is to use the word family in it. And it would be like Binder Family Chiropractic. And so there's tons of chiropractors out there who it's like Stephen Family Chiropractic or whatever. And the crazy thing is I never really got that. I couldn't do that. So because to me, it sounds like, what is that? It's confusing. What does that even mean? Is your mother-in-law in the back taking x-rays? Like what family are you talking about? The reason why chiropractors do that is because they want your whole family to get adjusted. Dad comes in because of back pain, but then the family chiropractor says, oh, how's your wife doing? And, oh, she has hormonal issues. Oh, how are your kids doing? Oh, they get frequent ear infections. And so the family chiropractic is for the patients, not for the practitioners themselves. So, so pain relief chiropractic to me was always the funnel. You know what I mean? It's the funnel. That's how people find chiropractic, and ignoring pain has never been really a practice strategy of mine because people want to talk about it. And I think that the body is very intelligent and the body says it hurts right here. Oftentimes, but not always, oftentimes, that's a really good indication of what's happening. Oh, right there? Okay, that's your rotator cuff, right? What's on top of that? Just the deltoid. Maybe it's a bursa, or maybe there's a tendon from the bicep, or maybe it's the joint capsule or labrum, right? But there's only so many physical things, but at least the pain is pointing to it. And then when you start touching it and testing it, then you get really good indications of where the pain is. Now, there could be pain in someone's tendon right here, and that's because their scapula is not articulated on top of their rib cage good enough. If you just saw that last video I did with Brandy, that crazy clunking that she had, it's because there was a dysfunction in it's not technically a joint, but in the articulation between the scapula and the rib cage. And so the rib cage is directly attached to the thoracic spine, and the shoulder blade is also directly attached to the thoracic spine through the rhomboid muscles. And so, does adjusting the thoracic spine help people with their shoulder? Yeah, absolutely it does. Look at Bo Hightower, who's an expert in shoulders. He still manipulates the thoracic spine, and it's because why wouldn't you clear out the garbage? Why wouldn't you? And so, adjusting people for pain. It's a 10. Chiropractic is a 10 for getting people out of pain. But then there's this next level of things that are happening, that we know are happening. Changes in your blood levels of white blood cells, changes in blood levels of indicators of DNA repair. DNA repair. That's what we're going to talk about next time. DNA repair. All right. That's a good place to end it, I think. So thanks very much for hanging on. I appreciate you watching my 25-minute video on chiropractic and the immune system, where I just rant and rave like a madman chiropractic. But that's what it's going to come down to, man. It's just ranting and raving like a madman chiropractor, because there's a lot of possibilities and potentials for people out there, and chiropractic is the baseline for that. And what that means is, like, even tonight is the motocross rider. Like, he was like, he you know, he had pain and I adjusted him and it was better, but he wanted to explore more about things like meditation and the nervous system, and creating peace within your body so your body can do what it's meant to do, and that's be healthy. Because oftentimes disease is it's an interruption in your body's normal processes. That's the one thing that chiropractic and Eastern medicine all hold in common, is that, okay, the body's amazing, okay? In Western medicine, the body's bad. No, your gallbladder's bad. We need to take it out. No, your appendix is bad. We need to take it out. They just take things out and, you know, replace them. But to get to that level where something needs to be taken out, you have to really ignore yourself and your health for a very, very long time. So don't ignore yourself. Don't ignore your health. Love yourself. Get some good sleep. Drink enough water. Eat clean food. Have clean thoughts. Right here. Keep it right there. Psychoneuroimmunology is a book that I found randomly. I was just in the library. It was before I even started chiropractic school. Hans Seeley. He's a doctor in the earlier 19th century, and he was the first person to really detail this process, psychoneuroimmunology, which is basically your thoughts affect the production of neurotransmitters in your brain. You create reality with your thoughts, kind of thing. You create perception with your thoughts, is really more accurate way to think about that. And that will affect your immune system. That means someone who continually is negative and finds and is in a bad mood and finds things that are wrong with the world will perpetuate that mindset. And that mindset has an effect on the immune system. Whereas people who who think positively, find gratitude, those kinds of thoughts will affect neurotransmitter release, and then also down through the parasympathetics, the activation of your immune system, making you healthier, making you more able to fight off coughs. Now listen, here's the crazy thing, is like, I agree with modern Western science to a degree, because chiropractors don't live any longer than any other population. It's just not true. We don't live to 110 years old, all of us. We die just like everybody else. And people still get sick when they're getting adjusted, and still get coughs and colds and flus and things like that. We're not saying good chiropractors, we're never saying these blanket statements that, like, all you need to do is get adjusted. The good chiropractor is assessing your spine, removing the interference, so at least that's covered. Then you go from there. What's next? The ball's in your court. I mean, I tell every single patient, I'm going to give you the tools so that you need me or any doctor much less. I mean, it's the medicine is inside of you. All right. Peace out. Hi, everybody. Goodbye, everybody. Thanks for joining in. I'll be back another time. More ranting and ravings. Thank you very much. And